welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn, and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have a very interesting program for you tonight as we explore the fields of physical therapy and sports medicine. Our Channel 5 cameras will take us behind the scenes of one of our area's largest and most modern physical therapy centers, and we will meet and watch physical therapists as they evaluate and assist patients suffering from injuries to muscles and bones. Before getting to our topic tonight, let's take a look at the latest medical news. Doctors and nurses across the United States are attacking what they say is government interference in deciding whether handicapped infants live or die. At issue is the controversial baby dough regulation recently announced by the Surgeon General of the United States. It goes into effect in 60 days and affects 7,000 hospitals that get federal aid. The new rule will require posted warnings in hospitals that it is illegal to withhold medical treatment from handicapped infants. It will also encourage informers to report suspected infanticide on a hotline to the Office of Civil Rights in Washington, D.C. Negligence could cost a hospital its federal funds. The rule is named for an Indiana infant with Down syndrome who was allowed to die. President Reagan and Right to Life groups say the government has a right to protect handicapped babies regardless of parents' and doctors' wishes. But a well-known Philadelphia pediatrician called the notice ludicrous and haunting for parents. Quote, "It makes the whole medical profession and the parents guilty until proven innocent," unquote, he said. He feels the children will no longer get proper care in order to satisfy this regulation. In another medical news story, findings indicate that jogging can be hazardous to your health, especially when the air quality is poor, say University of California at Irvine researchers. They found that rats suffered more lung damage when they jogged in air polluted with ozone, the byproduct of car emissions, than when they sat in polluted air and did not exercise. A physiologist reported in Omni magazine that rats jogging on a motorized treadmill while breathing ozone developed 5 times as much thickening of the lungs' air sacs as those rats that were resting. And those exercising rigorously had up to 14 times as many lung lesions. The physiologist said that rat studies are not always applicable to humans, but joggers should check the pollution index before running. My health tip for tonight concerns women who wish to travel while they are pregnant. A pregnant woman can take a healthy and hassle-free vacation this summer if she follows the following advice from the American College of Obstetricians and Gynecologists. If you are pregnant, ask your doctor for any special travel advice. Try to travel during the second trimester. These are months 4 to 6. If you're traveling by car, wear a seatbelt and make frequent stops to walk around and restore circulation to your legs. Try to get an aisle seat on planes so that you can get up very easily. Use a sunscreen. Your skin may be more sensitive during pregnancy. And finally, around the last month of pregnancy, check with your doctor about flying and long-distance travel. Now, on with the Medical Explorer. Have you ever wondered where to get help after you suffer a muscle strain or pull a ligament? Have you ever thought about beginning an exercise program after your doctor gives you the okay to start, but you just didn't know the best way to begin so that you could meet your own personal goals? There are very few health professionals who are truly qualified to advise you on caring for your musculoskeletal system. One of these unique health professionals is called a physical therapist. Let's travel over to Marysville now and visit our area's largest physical therapy center. I'm standing right now with Mr. Ross Scott in his very impressive physical therapy center in Marysville, which is also a sports injury center. Mr. Scott, why don't you show us some of your equipment today? I see you have a patient over here right now. What's he actually doing?
Well, Dr. Peppercorn, this is a young man that's injured his knee, and we have already started him on a rehabilitation type of program, and what we want to determine now is the strength that he has in this injured leg compared to this. And as we always tell our patients, we're more interested in making them as good as they were, not better than they were, and we certainly, with this type of unit, we have the ability to make them better in some instances.
What actually happened to his knee?
Well, he's a top-notch running back with the New York Giants, and he was injured when he was tackled after making a very long run and a very excellent run back and touchdown.
See a little scar right there. Something happened there. Is that the injury?
Well, excuse me.
Was that?
Yeah, that's where they did the surgery, right in there.
What happened? Was the ligament torn?
It was cartilage.
I see. But what is this machine he's sitting on right now?
Well, this is a unit that we use for both testing, and we have them set up now for the testing protocol. But we use the same unit to test as well as perform a strengthening program. And with this, we have the ability to produce a strengthening program at different speeds. Now, for a young, fast back, playing football is very important that he has the ability and the muscles to perform the maximum at the maximum rate of speed. So when we do a test on him, we'll have him perform at the maximum speed, and we'll have him do some warm-up speeds first. So let me go ahead and turn this thing on, and we'll just demonstrate this for you a minute. Okay, I've got that working at 180 degrees per second, and you don't have to concern yourself about that. It's just a testing protocol, something that we can refer back to. Okay, now I'll turn this machine on, and as he goes through the motion, he will be making a graph for us that we can compare later on. Okay, now are you ready? Okay, let's go, and push as hard and as fast as you can. Okay, he's pushing as hard and as fast as he can. I'll watch the graph over here, and when he gets to a certain point, then I'll have him stop. Okay, hold it, easy, and stop. So what I've done here is produced a graph, and I'll show it to you. And it'll be a strength graph, and it'll give us a good indication. I'll turn the speed down so there's not so much noise in here. But this graph will give us a good indication. I better turn it the right way up. Where his strengths and where his weaknesses are in this particular leg. And the graph on the bottom shows us the range of motion that he's going through. So if he was only going through part of his motion, then this would indicate on the bottom part of the graph.
So once you have this information, what does it let you do?
Okay, what we do from there is put it on another information sheet, and we work a percentage of weakness out for the muscle on top, which is the quadriceps, and the muscle underneath, which is the hamstring. And we know that we need, after we've tested the opposite leg, we'd put them over on this side and do the same protocol. And once we've done that, we know what the strengths are, should be, comparing the injured to the uninjured, and we're going to try and make this leg as close to this one as possible. And these, and these other units that you see in the area are designed to do that as well.
Okay. Let's move on over to your new computerized system.
Okay, fine.
It looks here as though you're using computers to test people's cardiovascular status, and this is very interesting with the exercise bicycle. Would you explain to our audience exactly what's going on?
Sure. What we have here is a device that's called a bicycle ergometer, and it's just a fancy name for a fancy bicycle that produces a certain amount of work, and we can adjust the amount of work that they perform. If we want them to do more work, then we put more resistance into the unit. If we want them to do less and go faster, then we do the same thing. So we'll have Laura get started here, and if you will, we'll start the bicycle moving. Okay, now I'm determined that I want to do a test for 5 minutes at 30 miles an hour and with 1.5 kilopounds of resistance. And it's just a measurement that I can go back to any time I retest her. Okay, now what I would do is to put this unit around her. This would be put over her head, and it'd be strapped around her. And then I'd hook up the unit here, turn the machine on, select a certain protocol that I want to test. And we have 5 different protocols, and we might be interested in running a test and with a maximum heart rate of 140 beats per minute. And that will be the maximize. We'll put all this into our computer, and when we get done with it, we'll have a printout that we have over here, and that will give us a measurement of fitness that we can reproduce and design a special fitness program for her.
So using this information, you could tell if a person's heart is working efficiently, or if they need more work to increase their respiratory and cardiovascular ability. Is that what you're able to?
That's absolutely true.
I see. And that would show up on the printout that
that'll show on the printout, right? Yeah.
Well, let's move on to another area now.
Sure. Thank you.
We often hear about using whirlpools after injuries or for other problems. Mr. Scott, what does the whirlpool actually do?
Well, the whirlpool is an excellent way to, we call it a hydro massage or a water massage, but it's an excellent way to get a joint moving. This young man has just had a cast removed. He had a spiral tibial fracture, and his hip, his knee, and his ankle were all involved in this injury. He had a long cast, a long body cast that came above his waist. He had that on for 3.5 months. So we're putting him in this, and he can very gently exercise, move the part. The bubbling water is very helpful. It helps reduce the pain. Go ahead and move the knee a little bit, Ross. That's it. Of course, you can see that he's able to move that knee quite a bit more than he could when he first started. But that's the idea, is to get heat, and actually the pressure of the water is very helpful, and it reduces a lot of pain. And we have a big pool in the other room that we can use for the same type of, okay, that's fine, Ross, just relax a second, that we can use for the same treatment, only it's large enough to walk in, and we have whirlpools and different things in there too. So that's essentially why we use the whirlpool. This is a full body whirlpool. We can use it for an arm or a knee or an ankle. They don't have to get in it. This happens to be, like I say, a full body whirlpool, and it's very helpful for this type of condition and situation.
We often hear about ultrasound being used to help people after injuries. I understand Joanna's had some type of injury here. What exactly are they doing with ultrasound here?
Well, Joanne is an avid tennis and racquetball player, and she happened to come up with a very disabling and very painful tennis elbow, it's commonly called. And what it is a bursa, which is a little sac filled with fluid that is normally in that area to protect the ligament that runs over the joint there, and this happens to be inflamed. So we're going to use the ultrasound to reduce the inflammation and hopefully speed up the recovery for her. Terry is going to demonstrate what she's doing. The first thing she's doing here is putting a coupling agent on, and we can use a number of things.
What exactly does that mean?
A coupling agent is something that you have to use in order for the sound to be transmitted from the end of the sound head, which is, here, go ahead, Terry, I'll show you with this one. This is a sound head, and the ultrasound is produced in a circular area here. And the sound that is produced flows at the rate of 800,000 to 1,000,000 sounds per second, and that's why it's called ultrasound. But it has a number of things that it does to the tissue. One of the main things is to produce local heat in the area, increases the circulation locally between 7 and 9 times what it normally would be, and it also will liquefy a substance which is a colloidal or a thick, like a pudding type of substance. So if she has that condition in her bursa, that will liquefy it and allow the body to reabsorb it. And this is essentially why we'd use the ultrasound in that treatment.
Joanne, how does it feel?
It feels like warm.
There's no pain or anything?
No.
Not at all. Does it seem to help your injury?
Mm-hmm. It does.
How many treatments do you usually need?
I don't know.
How many treatments do you usually need?
We treat symptomatically when we're using ultrasound, unless we have something in X-ray that determines that there is a density that we want to get rid of. So when the patient is asymptomatic, this is when we discontinue the treatment. But usually 3 to 5, and in a condition like this, if we've got it early enough. Now, very often, if it's a chronic type of thing, we have to instill or add an exercise program. This is a thing probably that physical therapists have the ability to do more than anybody else. We can design an exercise program to strengthen the muscles that blink your eyelids, for instance. We have over 1,500 specialized exercises that we can give for any part of the body.
The physical therapist did an outstanding job this evening showing us some of the techniques used in the modern practice of physical therapy. Let's meet again with Mr. Ross Scott and discuss more aspects of physical therapy and rehabilitation. Mr. Scott, welcome to the Medical Explorer this evening.
Thank you, Dr. Peppercorn. It's a pleasure to be here.
Thank you. Let's begin by having you tell us about your extremely interesting background in education and training in physical therapy.
Well, I go back a few years, as some of the snow on the roof would indicate. I was the first physical therapist in the area. I was very fortunate to have my training at Stanford University Medical School, and I was also very fortunate that I trained during the era of the polio epidemics. I was on the staff at Children's Hospital before coming here, and we had as many as 175 polio patients at one time. And incidentally and interestingly, it was one of the reasons that I came to this area. I had some young patients that were returning home from the hospital, but there was no physical therapist in the Marysville, Yuba City at that time, so I decided to come up and look around and liked the area and have been here ever since.
Is it true that you worked with the Olympic Games?
Yes, I also had a wonderful experience. I was chosen to be one of the participants in the Olympic trials, and as a result of that, they asked me if I'd return as the chief of the physical therapy and the training facilities for the 8th Winter Olympic Games. These were set up to take care of all the athletes. We had 150 medical specialists represented in our team. We even had mobile tents available that we could, in case an avalanche or something occurred.
This was in Squaw Valley?
This was in Squaw Valley, right. Winter Games were in Squaw Valley that year. But anyway, they had these mobile hospitals set up so they could take care of as many as 20,000 people, the medical needs, if this was necessary. And the way it worked, we had 4 complete physical therapy training facilities available, and as soon as the patient was removed from the hill, the ski patrol performed this duty. Immediately they were seen by the trauma doctors, x-rays, or whatever other diagnostic measures were taken. If it was determined it was a sprain, strain, contusion, something that was in our realm, we immediately started treatment. First day, we'd treat them 2 to 3 times, and many times this was all that was necessary to get them back into competition, and then we would follow up the treatment after they got through competition and many times before competitions.
Sounds very interesting.
It was probably the real highlight of my career. I even had a chauffeured limousine at my disposal 24 hours a day, which I refused to ride in, but it was kind of neat to have these facilities and to have the pleasure of performing in that type of environment.
Now, the idea of a physical therapist is going to be a new one to many of our viewers. Would you tell us exactly what is meant today by the definition of a physical therapist?
Well, at one time, Dr. Peppercorn, physical therapy was considered as probably one of the oldest modalities or treatments known to man. I'm sure the old caveman heated up a rock and threw an animal skin around it and applied heat in this manner, and of course they probably had plenty of cold available. But it had its inception probably after the Second World War, when we had, and during, of course, but certainly after, when we had so many returning servicemen with varied and sundry injuries, including amputees and that sort of thing. And it's really grown from that area, and today it's probably an integral part of every medical type of treatment. We have specialists in our field, just as you have in your field, and we treat practically every ailment that the doctors refer patients to us for.
What does the state of California require you to do before you can become a licensed physical therapist?
The state of California, we're part of BUMQA, just as...
The Board of Medical Quality Assurance.
Right, yes. It used to be the... well, I had a different name for it, but anyway, we have to pass a written and oral and a... let's see, it's a written examination, an oral and practical exam, a 2-day exam. We have to be graduated from approved school of physical therapy. Most of our people have anywhere from 5 to 12 years of graduate and college education.
Where's the nearest program in physical therapy education?
Well, University of California Medical School in San Francisco has a department, and of course the school I went to, Stanford University.
How do patients find their way to your office? And I don't mean where on the map do they find their way, but do doctors refer patients to you?
Absolutely, Dr. Peppercorn. We have a 100% referral basis. The law doesn't require us to do that. The law requires us to take anybody that comes off the street, as far as the Physical Therapy Practice Act. But we have always traditionally and ethically worked with a medical practitioner. We feel that this is the person the patient needs to see first, and determine whether we have something to offer them or some other medical specialty field has something to offer them.
If someone wanted an exercise program, could they just call you right now, and would you see them, or would you ask them to see their doctor first?
No, the first thing I'd do is have them check with their doctor. If it happened to be a patient, a former patient of mine, I happen to know the doctor, I might contact the doctor and discuss it with them, but the patient would certainly have to make the contact with the doctor.
Well, let's now move on to some more specific areas of actual physical therapy.
Okay.
Many of us in this area are involved in sporting and other recreational activities. We're in a prime area for all kinds of activities, and we often suffer muscle and tendon strains. What should we do after we get one of these sudden aches or pains?
Well, I think the most important thing following an immediate injury is to use ice. ICE stands for ice, elevation, and compression, or ice compression elevation. And what you do is you make an ice pack of anything you have available that's cold, use an ACE type of bandage to compress it. You want to go above and below the injury, and you want to elevate it to keep the blood circulating and flowing back to the heart. If you do this many times, the next day you won't have swelling, you won't have pain, and you can resume activities.
When would you want to apply heat to an injury?
Well, I don't usually apply heat until at least 24 hours after an injury, but quite often I won't apply it until the signs of bleeding have disappeared, which would be heat, swelling, tenderness, this sort of thing. And many times, if we have acute muscle spasm or something like that, we use ice in preference to heat because we find that it's more effective, takes less time to reduce the pain and reduce the problems that are associated with the injury.
I see. Another problem that seems to be very prevalent in our society are backaches. What really causes backaches? Why do people get them?
Well, my anthropologist friend used to tell me that we had no business being up on 2 feet. We were designed to crawl around on all fours, but since we have made the transition, it's important that we find ways to protect our back, and certainly then protection is the most important thing. Most of the time we see patients after they have some type of back problem. Prevention is certainly by far the best way of doing it. Again, if you come up with a backache or you're interested in doing something in the way of preventing back problems, see your doctor. Your doctor will make the referral. We'll take a patient and examine them and try and determine why they're having backache. And we will give them a specific exercise program. What I try and do is just give them the basic essentials, what they actually need to protect their back, keep their back limber, and to prevent further injury. And then I will advise them on other activities, because I feel that physical activity is very important for the body. We were designed for physical activity, and if we spend too much time sitting in sedentary type of life or occupations, we start getting in problems as a result of it.
Right. Another area that seems to be popular for people to talk about are whirlpools and jacuzzis and things like that. Are they really beneficial, or do they just make us feel good when we sit in them?
Well, I think you answered questions affirmatively in both cases. We use whirlpools. We put different joints, ankles, knees, hands, elbows, and we're doing it specifically to produce increased circulation. The pressure from the whirlpool is pleasant. It helps to reduce some of the pain. We usually get a little increased swelling in the area, but we can reduce this by other means. Quite often we'll use a combination of hot and cold. We'll use a hot whirlpool to start to get a flushing effect. We'll use the cold whirlpool to get the opposite effect. And we balance them back and forth and usually end up with heat. Now, we have a big therapeutic pool that we have an overhead lift that we can actually lower a patient from a gurney or a stretcher type of device and start them on an exercise program, because water has 50% buoyancy factor, so if somebody weighed 100 pounds, they'd only weigh 50 pounds in water. So with a very weakened and weak muscular system, we can start activity. We have walking bars in there, and we have also the whirlpool. So we find it a very helpful and a very useful adjunct to our total treatment program.
So the comfort that it gives is not the only thing. It really is bringing in more circulation.
Absolutely. And I know if you ski, either water ski or otherwise, you get through a day of skiing and you're tired and you're sore, and you get in a hot jacuzzi or whirlpool, and it's very relaxing. What I like to do is get in it and go through a series of stretches and get stretched out, so the next day I can continue with my activity.
Right. Unfortunately, it's hard to believe our time's running out already. I'd like to thank you, Mr. Scott, for taking time out of your busy schedule and joining us tonight on the Medical Explorer. Thank you very much.
My pleasure.
I'd like to invite you to write to me at the Marysville Medical Clinic with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 800 3rd Street, Marysville 95901. In my next program, the Medical Explorer will examine another exciting area on the medical frontiers in Marysville and Yuba City. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.